your knee is like this. Now, you can actually do this two different ways. I don't mind which way you do. Some people will actually grab two hands and pull, and what you're looking for is you're looking for either a laxity where you feel like a clunk would be a positive, or I also consider a positive if the patient says, ooh, you know, it hurts right there. That's also a positive for possible problems with the ACL, okay? The other way that I do it, and I said I'll accept either way, it's fine. I've always found that it's easier for me to wrap my arm here, hold the foot down like this, and then use my weight. I'm not going to have to like hurt my back or something to do this, so I like doing it like this. And as you can see, I can easily move her whole body. I can really put some good weight on it. Then the posterior drawer sign, it's just the opposite, right? You stabilize him, and you're literally just pressing as hard as you can. And again, you can do it from down here, okay, from the side, or you can take your arm. If you're not that strong, you can use your body weight, okay? So that's fine. And again, positive would be, again, pain in the back because you're testing the PCL, okay? But you want to do that. Now, for the exam, I'm only expecting you to do that for one side because normally as a specialty test, you're going to do that test where they're having pain. Okay, we're not going to do it like bilaterally as a survey. So just the one side is fine. And I would just verbalize something on the exam. If the patient had pain on the left side, I would then do this test, okay? Something like that. Okay, for the varus and valgus stress, the easiest way that I found to do this is do it from the side. You grab down low, and you're going to have your hands on the opposite. If I'm going to stress the joint medially, then I put my left hand medially, my right hand laterally, and then press, and I'm trying to imagine stretching this ligament, okay? So that's how you do that. I won't do this too hard. Just tell me if you have any pain. No? Good. And you really want to see, like, you see that movement and you see the joint move, you've really got to press kind of hard, okay? But for exam purposes, you can do it fast. Over here, then you have to come to the other side to do the lateral aspect, okay? And again, you're pulling with this direction, pushing towards this opposite, okay?
That's varus, sorry, varus.
Yeah, this is valgus, pointing outward, yeah, and this is varus, would be pointing inward, right? Bow-legged varus, and then knock-kneed valgus. No, just so there's no confusion, guys, you can kind of figure that out for yourselves later. If you want to just make it real simple on yourselves, just come over and say, I'm stressing the joint medially, I'm stressing the joint laterally, okay? Because I know that sometimes the varus valgus terminology is kind of confusing until you get that down. But remember, varus and valgus has to do with from the knee down, where is that tibia pointing? If it's pointing outward, which means the knees are going to be knock-kneed, that's valgus. If it's pointing inward, right, so her tibia is pointing here and she's bow-legged, that's the opposite. Okay? Got it? But, you know, for exam purposes, if you're trying to move along, it's okay to say, I would stress the joint medially, I would stress the joint laterally. That's okay too. I'm not going to get picky on that. Okay? Let's see the rest.